You're absolutely right. I mean, it's sad. I also teach one of the university's masters. And I can tell you, people did MSc in implant dentistry and they're not placing implants. And it's sad because I know they have the knowledge, but they did not get the after-sales support.
Have you ever been on a dental course and not applied the knowledge, and because you never got to apply the knowledge, you felt as though it was an absolute waste, because really, if you didn't get to apply it, you didn't get to treat a patient with that new technique you've learned, it really goes to waste. So sometimes, we do these courses and they can cost a lot of money and we don't get the best out of it. For example, I went on a laser course last year. I've hardly touched a laser since, so I feel it's a waste, and I know it's my own fault and I take full ownership of that, but I think sometimes the stakes can be even higher. Beyond just a laser course, imagine doing implants, for example, and investing heavily in an implant course, and they're not cheap, let's be honest. And imagine doing that, and I've got some friends who've done implant pathways and programs and have not been able to put it into practice. Now that can be a costly mistake is one way of putting it, or a costly discovery that actually maybe implants is not the right path for you, or whichever path you've done or invested in isn't best for you. That's why I've got Dr. Hassan Meghera with me today for this two-part episode. The first one, and it's a mammoth topic, right? The first one is how to know if implants is the right path for you and how to get started within dental implantology. And part two is assessing your patient for implants. Who is the best patient for implants? What is the requirement for space dimensions, bone, delaying the implants versus immediate? All these sorts of things that will hopefully cover the very fundamentals. So even if you don't place implants at the moment, that you'll be able to gain from these two episodes. Just a bit of news before we dive into the episode. Occlusion 2020 was a massive success. Thank you so much for all of you who took part. It didn't feel like a Zoom sort of a conference, if you like. It felt more than that. It was so much more energy. The chat was on fire. It was a lot of great banter actually, and it was so great to see everyone there. And the beauty of it is that replay function. I really do think online education really is the way forward in dentistry. Who would have thought 5 years ago that so many of the courses and education can be delivered online? So it's really great, and thank you so much for supporting us with Occlusion 2020, and thank you to you guys listening right now for helping this podcast grow. And I'm always in a good mood to say these positive things because it really puts a smile on my face. For example, recently, about a month ago now, a German dental student reached out to me and told me I was her favorite English podcast. So Sophia, thank you so much for listening. And all of you, I get loads of messages of gratitude, and I really love that, and it's very, very great to read those messages. Sometimes the message like, you've rekindled my passion for dentistry, like, oh my god, I can't get over that. So please, let's keep going. If you don't mind recommending me to a friend or a colleague who hasn't heard about the podcast, that's how the podcast grows. That's how I can have more varied, interesting guests. So I really appreciate all the hard work you guys have done in helping to promote my podcast organically. And funnily enough, I found out that the Protrusive Dental podcast last month was the #1 ranked podcast in the category of medicine in Qatar. So shout out to all my listeners in Qatar. You took me to #1, baby. Hopefully Qatar is done, but hopefully the world next. The Protrusive Dental Pearl I have for you is dental photography related. So whether you're still to get started in photography or you're taking photos already, I think you can gain from this. It's to do with equipment, right? Like if your biggest barrier is the expense of buying a camera, firstly, let me say it's totally worth it. No matter how much a camera costs, dental photography will really elevate your work. It'll bring you so much more satisfaction as a dentist. So just do it. However, I know young dentists, 1 or 2 years out, and you feel as though it's a big investment to make all at once. So my advice to you would be to consider buying your photography equipment secondhand. Now, when I bought my camera 7 years ago, I got it from Gumtree, or if in the US, Craigslist or whatever. You can buy used camera and camera gear from a photographer, for example, who's looked after their equipment really well, but now because they've upgraded, they essentially can sell their equipment, their older equipment that is really valuable to you at a much discount price. Now, as dentists, we don't need a particularly fancy camera body, okay? The body itself can be fairly basic. the lens should be good, and the ring flash should be adequate. So really, there's no reason to break the bank over all this, and you can buy used models. And even on websites like in the UK, we have WEX, W-E-X, where they have refurbished items. So I would totally explore buying equipment, whether it's due for renewal or your first purchase, secondhand, or as a refurbished item on these photography websites. And the sooner you get started taking photos, the better. So that's my pearl for you today. Let's jump in with the episode with Dr. Hassan Magara with getting started with dental implants. Dr. Hassan Magara, welcome to the Protrusive Dental Podcast. How are you?
Hello. Hi, Jazz. Thank you very much for having me. I'm very good, and good morning to you and all our colleagues listening to this nice podcast.
Yeah, thanks for tuning in, guys. Really appreciate it. And today I've got, can I call you Hassan?
Yes, please do.
Hassan's someone who I've seen a lot over the years on the social media presence, and his passion for implants and teaching really stood out to me. So that's why I reached out to Hassan, because a lot of the listeners were like, can we just have a bit more implant stuff, especially when it comes to the journey of implants. So Hassan, if you don't mind, we're going to cover a couple of things today. One is getting into dental implants, and two is just, if you're looking for your first couple of cases, or if you're looking to refer, what is the basic requirements, suitability assessments? Can you place it in smokers? What about timing of extractions? Obviously, in a podcast like this, you can only scratch the surface, because I'm sure there's so many nuances, right? But any direction you can give to the dentist, that would be great. And Hassan, can you just please tell us a little bit about yourself, about your working week and how you got into implants yourself?
Well, thank you very much, Jazz. Basically, for me, implant dentistry is one of the most rewarding aspects or branches of dentistry. And I strongly believe that every single dentist has a duty to know something about implant dentistry. In fact, as we all know, GDC here in the UK makes it mandatory for every single dentist to offer implant option to their patients, even, if they think, patient won't go for it. Never judge a book by its cover. Should always offer implant dentistry as one of the treatment options. And I strongly believe that, people who like to go into implant dentistry, they're going to find it very rewarding, providing they start right. What starts right goes right. Why do I say that? Because it's so easy to slip into implant dentistry through the wrong doorway or through the wrong entrance, and then start to mess up your career and you lose fun. The way about implant dentistry, let's admit it, maybe in UK and maybe other countries, undergrads don't get enough education about implant dentistry. Hence, every dentist, will need to pursue a career in implant dentistry through some post-continual education or continual education after graduation. And that could be either through masters, if they want to get into research and thesis, or if they just want to reach a level where they can be safe implant dentists. There are so many good courses, continual educational courses, which, according to the General Dental Council of the United Kingdom, has to be a long course with integrated mentoring scheme, and that course needs to be completed with an assessment. Hence, only then if someone can say, now I'm safe to do implant dentistry.
Well, I'm glad you mentioned that, Hassan, because straight away that leads very nicely to the first overall question I want to ask, which is basically, when we do our undergraduate studies, like with a lot of the dentistry, we scratch the surface. I know dentists who have done one molar root canal, or even, dare I say, no molar root canals, and they've got a BDS, Hassan. Okay, so don't even think about implants if they have done maybe 7 extractions and 1 molar root canal. This is the state, okay? And I don't know how much worse the pandemic's going to make everything, right? So we're qualifying with way less experience than we used to. And you don't get to dabble or get your hands into implant dentistry. So how can you be sure it's the right path for you, and to even begin to think it's now worth investing some money into the path of learning? Because you quite correctly said the way to learn implants will be through private courses or masters, just like you said. But how do you know it's the right thing for you? Are there certain traits that you see in someone, in a clinician, who you think, they may have a fruitful career in implant dentistry, or a certain type of individual, a student, maybe should focus on something else? Any sort of light you can shed on that?
I think, Jazz, it's a decision every single person will need to make. You and I know, let's talk about dentistry in the United Kingdom. At the beginning, once you graduate, you need to make that decision. Are you going to be NHS 9 till 5 dentist who just, happy to settle? Or are you someone passionate, wants to take the challenge one step forward, do some more challenging cases, wanting to spend more time with your patients, wanting to keep your patients in-house, even wanting to, upskill and upgrade your CV so you can get better jobs later on? So this is the first question every single graduate needs to make. Where do you see yourself 5 years down the line? Now, should you decide that, NHS dentistry is not for me, I want to be someone different, I want to be above average, then the second question is, right, which part of private dentistry you think you can be enjoying that? Okay. Now, we know jack of all trades, master of none. So you need to somehow develop passion in one aspect of dentistry. I'm not saying don't do the rest of dentistry, but just develop passion where you sort of start to attend evenings, open evenings, congresses, lectures. And if you find out that, this is something I see myself doing in the future. This is something, hopefully in 5 years' time, I'm going to be doing that with passion, with confidence, safely, then you could make that decision. All right, let's go into implant dentistry. Before going into implant dentistry, it's always wise to find someone you look up to, like a mentor or someone in your city where you referred some patients to before, and say, pick up the phone and say, can I come and shadow you for a day or two, please? I'm not sure about implant dentistry, and I know that you're someone who does implant dentistry regularly. I just want to come and stand behind your shoulder and see how things work. I'm sure you're going to find lots of people welcoming you. And only then you could say, right, this is for me. It's time to invest. Let's take it forward.
I think it's great you mentioned the role of shadowing. It had a huge role in my career trajectory. I shadowed lots of great dentists, and that's the reason I'm a general dentist who likes to do ortho, likes to treat tooth wear and stuff like that, because it's a dentist that I shadowed and that really influenced me. I also shadowed some implant dentists, and I went down and I did play some implants on a course which I shall not name as an international one, and I didn't have a great experience, and I think it was due to the education I received at that point. And I do think if I could go back in time, I would have picked a different sort of route for getting into it. But now I'm enjoying because I've got a diploma in orthodontics now. I'm doing more of that. So that's how I went about it. But really, I think you raised a good point that if I was to summarize it, you have to kiss a lot of frogs before you find your Prince Charming, basically. You might have to go on that endo course. You might have to do some endo in practice, and then start making some dentures and maybe shadow a prosthodontist and then eventually maybe shadow someone who places implants, and try and figure out which one or two micro areas within dentistry really resonate with you the most. And I think it's so great that you mentioned the role of shadowing, which, by the way, has been complicated by COVID, unfortunately. There have been a few dentists who've messaged me, you want to shadow. I've messaged a few dentists, I want to shadow. And because of the whole COVID, we just don't know whether to go or not. But obviously, this will pass. But it's a great advice you give to find someone in your city, potentially someone you refer to, shadow them, and see if that's a career for you. Is there anything you want to add to that before I go to the next question, Hassan?
It's perfect point what you've mentioned. I mean, obviously, COVID is a temporary, and hopefully it will not continue. But you don't have to invest in courses, maybe congresses, conferences, and don't look at it as a waste of time, because you as a dentist has a duty to develop basic knowledge about every aspect. So a patient comes to you and say, am I suitable for an implant? You can't say just, to be honest, I don't know. You have a duty to know the basics about implant dentistry, at least, to be able to answer these questions. So we have in the United Kingdom, ADI, ITI, they're both two big organizations, and they offer annual congresses and conferences. And I think every dentist should go and give it a try. And only then you could decide this is for me or not.
Brilliant. The next thing I want to ask you then is that there are some dentists who end up doing some implant training and investing their time and money into it, and then they don't fly with it. They don't run with it. It happens in anything. Like, you have some people who do an orthodontic diploma and they don't do as many orthodontic cases afterwards. They do an endodontic program and then they decide not to not specialize, or they don't make their practice limited to endodontics because they just don't get around to doing it. And they spend all that time and money into that field, for example. So how can you ensure that if you were to do some implant training, what's the way to make sure that you can hit the ground running and get some cases under your belt and actually not then just give up implant dentistry a few years later, despite investing time and money?
Jazz, this is an amazing question. And as you might know, I mean, we run a course here in Leeds through the British Academy of Implant Restorative Dentistry. And I get a lot of people calling me, asking about the course. And actually, the more important question is, what support the delegate going to get after the course? Because there are so many good courses here. And, the differences can be minute between one course and the other. But what really makes it or break it for you is what support you're going to get after the course. And I think every person who's going into ortho or implants or endo, continual education, try to link yourself to a group in that field. And only then after the course, the discussion, the mentoring, the encouragement comes from the family. So in BEAR, the British Academy, we like to feel like we're a family, and we have annual meetings where we can encourage each other. I mean, whenever someone has a challenging case, we have a mentoring scheme, integrated mentoring scheme, where someone can come to your practice and help you to do this challenging case. You've got a simple case. We have this platform where people discuss these cases together. So I think in general, in dentistry, whether it's implants, ortho, or endo, whenever you want to look into a course, especially if we're talking about a serious course leading to course certificate or diploma, you need to be asking the question, what support I'm going to get after the course so I can start to, get the reward of my investment. You're absolutely right. I mean, it's sad. I also teach one of the university's masters. And I can tell you, people did MSc in implant dentistry and they're not placing implants. And it's sad because I know they have the knowledge, but they did not get the after-sales support.
Okay, so Hassan, thanks so much. So the next question I have then is, there's a school of thought with implants, you should go all in, because to me, there's so many systems, so many complications, surgical and restorative, that if you just dabble in implants, you will never reach your true potential, or you may not be as successful as someone who just dabbles. So where do you think the humble GDP fits into it? I mean, firstly, do you believe that? And how does a GDP then dabble? Like, maybe a GDP places 6 implants a month. Is that a decent amount? Is that okay to practice in that sort of field where you're placing that number? Or does it really need to be either 0 or 50? Like, do you understand what I'm trying to say?
Yes, 100%. Let me take you one step backward. As a general dentist, you have a choice of going into implant dentistry at 3 levels. Let's say level 1, which develop the knowledge. And I think this is now becoming mandatory. Every single dentist needs to have enough knowledge. So whenever you're doing a consultation with someone coming to you with a failing teeth or missing teeth, you need to have the knowledge talking to your patient about implant dentistry as an option. And I strongly believe this is mandatory. Okay? Now, the next level is to refer your cases to someone you trust so they can place these implants, and then you restore them in-house. And the advantage of that imagine you're having a central incisor missing tooth, you're going to want to refer that for an implant, but the adjacent front teeth need some veneers or crowns. So it will make sense for you as a general dental practitioner to have one impression for all of them. You get the nice matching color, the everything all in one scheme. And also, you as a general practitioner will have the knowledge to be able to follow up this patient. Okay? but you need to be trained to do that. Training how to restore implants and link yourself to someone you trust where they can place implants up to the standards you expect. Now, the third level is to say, right, I want to provide a service, in-house service for my patients where I don't want my patients to go somewhere else, because like it or not, I'm a dentist who accepts referrals from colleagues. And I think I might regret saying this later on, but patients like it when they have all the treatment in their own practice. For a patient, over the years, they've developed this comfort zone, this trust relationship with their dentist. And when you go to them and say, do you know what? I'm going to need to refer you to see someone else in another practice. For them, this is completely unknown and they're taking your word for it. So it would be nice and amazing if you, who is for them the dentist they trusted over the years, who can continue this treatment. So you as a clinician need to make that decision. Where do you see yourself? Now, the moment you said, right, I'm going to start placing implants, then we've got another 3 levels. According to the ITI classification, which is available on the ITI website for free, you could feed all the information about the case on that website, and then you're going to get a classification, whether it's simple, advanced, or complex. I mean, no one would expect you to go and jump into complex cases within the first 3-5 years of your implant career. So what I mean by simple, like a case where it's a lower molar, we've got loads of bone away from the nerve, simple flap, no challenges, you could place that implant. Now, obviously, you need to have the training to be able to do that simple treatment. And then you do simple cases by yourself for the first couple of years. And whenever you have an advanced case, rather than referring this case to someone else, you could call your mentor and your mentor can come to your practice and you and your mentor do that advanced case together. So you're learning one-to-one through this mentoring session. Your patient having treatment in-house, so no need to disturb the patient journey. And that you've done the best of treatment for your patient. Now, the third level, which is complex, and that's when your mentor or someone really advanced in their training, we're talking about atrophic jaws, talking about sinus grafting, that's when you can refer your patient. But these are not very common cases. We're talking about 10-20% of the cases. So personally, I am a big advocate for every practice to have their in-house implant dentist. And if you're that associate or that practice owner who has passion for perfection, for surgery, for restorative nice work, I think you should go for it and give it a go. And yes, you will hear people telling you it's either all or none. My advice, it shouldn't be like that. It's gradual, like anything else in our life. We don't go all or none. You don't go from no driving license to driving Aston Martin. You start with a Ford and then you go up until you reach your dream.
When you start moving up a gear and you start doing more complex cases, that you have the mentor come in and you do the case together. I think some of my best learning experiences as a student, as a learner, have come from that sort of arrangement. Like I remember being in the DCT position in oral surgery at Guy's Hospital, and I had this complex surgical wisdom tooth, and I was struggling. So one of the registrars came and held my hand, and she was retracting the cheek, and she was telling me what to do as I was doing it. She's like, no, hold it like this, hold it like that. And those have been the most powerful learning experiences for me. So I think that's a really good point you make there. And that can be applied to any field of dentistry. If you can have someone to hold your hand, not just like over Facebook and send them photos and they give you advice, because that is really valuable as well, by the way, and by email relationship. But what I actually mean is that someone being by your side and seeing the patient together, and for them just giving you those little micro tips that will just make your dentistry go a long way. So that's a great point. And the last question to wrap up this theme of getting started with implants is the following. When we qualify, at what point should you decide, okay, now is a time? I know you mentioned about level 1, 2, 3, which I really like, by the way. And I think the way you described it is so good, because you can do level 1
very soon after qualifying, because it's just the core knowledge which we need to have, even according to GDC. But let's say you want to start taking things a gear forward. Here's my perception. My perception is you should be able to take teeth out comfortably enough before you even start thinking about placing implants. Because for me, that was around about 3 to 4 years afterwards. Now, when I see any sort of extraction, it doesn't faze me as much. Before then, I was like, am I going to be okay? Am I not? Now I reach a position after the 4-year point where I thought, okay, now I can do some simple surgicals, happy to section elevate. Whereas some dentists might jump straight into the deep end without even mastering extractions. For me, that's how I was once taught is a good point to consider about the surgical aspects of implant dentistry. What do you think about that? How do you know is the right time? And do you need a good restorative background before you start going into level 2 and level 3 of the implant pathway you described?
Okay, that's another very good question we always get from people who are passionate. They want to do something as quick as possible, but then they want to check, is it good time for them, or are they doing it too early or too late? Now, my advice would be, after you finishing your dental degree, obviously you've got to have 1 or 2 years of general dentistry experience. And you're absolutely right. You need to have some knowledge about restorative techniques in general. You need to know how to take a tooth out. And not only taking a tooth out, you need to be learning and focusing on how to be gentle in taking teeth out. Because when it comes to implant dentistry, it's all about the bone. It's all about that labial plate, which is in 87% less than 1 millimeter thickness in the anterior zone. So you could see we're talking about very thin structure. And it will make or break your implant case in the future, having that labial plate intact or not. So absolutely with you that you need to have good skills, the minor oral surgery skills, some restorative understanding. But on the other side, nowadays, people like me and other directors of other courses, whether it's university-led or private-led, we acknowledge that, and we started to integrate this as part of the education we offer to our participants. So our implant course is a 24-day over 8 months. And in a part of these 24 days, we do lots of hands-on teaching on taking teeth out, on managing little tiny simple flaps, suturing techniques. So we take people assuming they haven't ever done a suture before. They haven't ever done a tooth out. And we sort of put that as part of the course. Now, you could decide to learn how to do oral surgery by yourself and your patient after taking 100 tooth out, or you could come and attend a 1-day course, which saves you the trouble of putting yourself and your patient through the stress and the trauma of trying to take a tooth out. So again, the question is, you need to look at what sort of things going to be covered in that course. I mean, in our course, it's an implant course, but we also have a full module on occlusion because we acknowledge the importance of occlusion in implant dentistry. Exactly.
I was celebrating there for those driving and didn't see that. I was very happy to hear that.
He was jumping up and down. So yes, definitely, because to learn an implant is not only about the screw. It's all about stabilizing the mouth, stabilizing the whole structure, the pink structure, the bone, the adjacent teeth. So some courses will just teach you how to place an implant, and other courses will have more like holistic approach where you go from A to Z, look at the whole thing. And I would like to think in my course or in our course, we cover all that. One of the brightest graduates we had were people who came to our course 2 years after graduation. And I mean, if I can mention someone called Son came to me. He was the youngest participant immediately after VT.
Sun Ku?
Yes.
He's a very dear friend of mine. Son is a very dear friend of mine, and yes, I didn't know it was your course that he did. That's brilliant. He's loving it. Amazing.
And now he's at his young age. He's a mentor. So what I'm trying to tell you, it's up to you to decide when you want to start. And I go to people say, because I do have some of my colleagues and respected colleagues, they say, you cannot go into implant dentistry too early. You have to be 5-10 years of experience before giving you two implants. And I beg to differ, because imagine yourself 35 years old. I would like to think when you're 35, you should be at the top of your career, okay? If you're 35 with 5 years or 10 years experience in implant dentistry, it will make a huge difference compared to if you were 35 with 1 year experience of implant dentistry. So the earlier you start, and you do the course, doesn't mean you're going to finish the course and go and do full arch. No, you do the course and start with the simple cases. And that put you the first 2 steps in that pathway. And then from there, you develop your passion, you attend conferences, courses, continual advanced courses. So by the time you're 35, you can do full arch with confidence. And that's what I would prefer to do if time goes back.
That's a great way to look at the pathway. But I'm so happy you mentioned San. This is completely unexpected, actually. It's so great to celebrate the success of one of my dear friends. And if you ask him, he's very humble. He would say success, that's the wrong word for me. He's a very humble guy. But I remember, because we're in the same, we're best buds. And I remember when he was saying so soon after dental school that, look, I want to go to implants. But he'd been thinking about that for a while. And he went into it knowing that he'd be one of the youngest, least experienced, and he was very grounded. He said that, look, I know I have so much to learn. And the way he took it, I remember he actually got extra mentorship. He actually, I believe he paid for it or whatever he needed to do, but he did it the right way. He went the right way about it. And I love what he's doing now. And he's really dedicated. He's got a purpose. So that is a great case study, and I'm so glad you mentioned him. So it shouldn't put anyone off if you're too young, but you have the desire and you have the willingness to put the hard work in. It's all very achievable. So I think that ends this part 1 in a very nice way. So this was all about getting into it. We asked some questions like, at what point, what core skills do you need, what to look out for, is it right for you? Any closing words on this segment, Hassan, before we move to the next one?
Jazz, you just mentioned an important thing. You said he did the course, but he had to invest more. And this is the other message. Please don't be deluded or deceived thinking that you're doing the course, that's it, you're going to be a perfect implant dentist. Any course, whether it's even master's degree or one of the private courses like the birth course, which we do over 24 days, which is an intensive, and we offer patients as part of the course to our delegates. Even that is only your first step. You need to be willing and ready to invest. You have to invest into mentoring after the course. You have to invest into attending like advanced soft tissue and bone management courses after the course. So it's a marathon rather than a sprint. If you're ready, and if this is something you want to go for it. Don't let anyone stop you pursuing your passion. Otherwise, you might as well just leave implant dentistry to another colleague.
Well said. And another great point that you reciprocated there about having the need to continually invest more and learn more advanced techniques. And a great example I can give you is I got lots of good friends of mine who have implant dent in prosthodontics or implant dent in periodontics. And guess what? They go abroad to America, to Brazil, or to wherever to do advanced soft tissue courses. My prosthodontics colleagues, they are the biggest CPD junkies I know, even though they have, they made it, they're a prosthodontic specialist, but no, they're still going for these advanced courses, techniques. They're continually investing in themselves. So it doesn't stop. So I'm sorry if you're listening to this and you're thinking, oh my God, it never stops. You need to actually see that as a beautiful thing that, otherwise you get bored, you become stagnant. This is the beauty of dentistry. There's not a single day that goes by that you don't learn anything new, and that will never stop. So I think that ends this part 1 really well. So Hassan, thank you so much for covering for us getting into the implant journey.
Thank you. It's a pleasure.
Protrusive, thank you so much for listening all the way to the end. I always appreciate you listening all the way till the outro. I really appreciate that. So I hope you found that useful with Dr. Hassan Magara. Watch out for part 2 of this, where we actually get a little bit more clinical, how to assess your patient and the spaces, whether they're suitable for dental implants. So catch on that one. There is an update in terms of social media. We do now have an Instagram page. It's at Protrusive Dental. So I'm going to use my own Instagram for my own things now. If you follow the podcast and you like the content and you want to keep in touch with the content, join the at Protrusive Dental Instagram. Give us a follow and we'll follow you back. Thank you so much as always, and I'll catch you in the next episode.